Good morning to one and all. Today our topic is tumor. Oncology means study of tumor. Oncos means tumor, logos means study. Neoplasm, altered cell population characterized by an excessive non-useful proliferation of cells that are unresponsive to normal control mechanisms and to organizing influences of adjacent tissue. Neoplasm. There are two types, malignant and benign. Malignant, cancer cells that exhibit uncontrolled proliferation and impair the function of normal organs by local tissue invasion and metastatic spread to distant anatomic sites. Benign, composed of normal appearing cells that do not invade locally or metastasize to other sites. Epidemiology. Overall cancer death rate shows slow steady increase. Lower death rates during past 50 years, stomach, uterus. Increased death rates are in lung and pancreas. Epidemiology. Cancer incident by sites and sex. In male, in lung it was 20% incidence, in prostate 20% incidence, colon and rectum 14% incidence, urinary 10% incidence, leukemia and lymphoma 8% incidence, skin, pancreas and oral 3 to 4%. In female, most of the incidence was in breast, it was 27%, colon and rectum 16%, lung 11%, uterus 10%, leukemia and lymphoma 7%, skin, pancreas and oral was 3 to 4%. And due to this, death ratio was cancer death by sites and sex, or in male, due to lung cancer 36%, colon and rectum 11%, prostate 10%, leukemia and lymphoma 9%, pancreas and urinary 5% each. In females, lung 20%, breast 18%, colon and rectum 14%, leukemia and lymphoma 9%, pancreas and ovary 5%, urinary and uterus was 4% each. The most significant 5-year survival rates are achieved in patients with cancer of skin, thyroid, cervix, uterus and bladder, with the lowest survival with pancreatic cancer. Females tend to have a greater number of 5-year survival cancer of any given primary site than males. Reason was unknown. 5-year survival female 50%, 5-year survival male was 31%. Etiology. Mainly maybe due to chemical carcinogens, hydrocarbons from coal tar, skin, larynx and bronchial CA. Aromatic amines cause urinary tract carcinoma. Benzene causes leukemia. Asbestosis causes mesothelioma. Physical carcinogens like ionizing radiations causes bone cancer. Multiple X-rays, skin, thyroid carcinoma will be caused. Atomic bomb will causes leukemia. Mechanical like chronic irritations, marginal ulcers, burn scar cancer. Infection, parasitic infections like schistosomiasis causes liver and bladder carcinoma. Viruses like hepatitis B causes hepatocellular carcinoma, Epstein-Barr virus causes Burkitt's lymphoma, herpes simplex virus 2 causes cervical carcinoma, and HIV causes acquired immunodeficiency syndrome. Precancerous conditions like leukoplegia, actinitic keratosis, polyps of colon and rectum, neurofibromas, dysplasia of cervix, bronchial, chronic ulcerative colitis. Hereditary factors like familial polyposis causes colonic carcinoma, breast carcinoma 2 to 3 times in daughters and in younger age. Oncogenes and growth factors. RNA tumor viruses cause carcinoma, sarcoma, leukemia, lymphoma. Retrovirus have an enzyme that alters genomic RNA, resulting to abnormal growth and differentiation of cell. Multifactorial like lung or breast carcinoma. Morphological changes. Rise from a single cell, revert to more primitive cell types. Normal orderly tissue patterns are lost or replaced by random pilling up of malignant cells with respect to definite pattern. High index of mitosis, invasion of adjacent structures. Biochemical changes like changes in DNA, RNA and chemical architecture results to loss of contact inhibition to proliferation and intracellular adhesiveness. Reversion of normal cellular biochemistry to that of embryonal cells that produce embryonal subs like CEA and alpha fetoprotein. Effector mechanism in tumor immunity. Host provides a number of effector mechanisms that destroys the tumor. Tumor antigen-specific antibodies, mononuclear phagocytes, natural killer cells, cytotoxic T lymphocytes, neutrophils, and K cells. Effective mechanism in tumor immunity. Now we'll discuss about tumor necrosing factor. Cytokines produced by monocytes, macrophages, endothelial cells, large granular lymphocytes, and neutrophils. Direct cytotoxicity for certain cells. Stimulation of procoagulant activity by vascular endothelial cells. Induction of fever by direct effect on hypothalamic thermoregulatory center. Classifications of neoplasm. Carcinoma arising from epithelial cells. Sarcoma is arising from connective tissue and cells of mesenchymal origin like fibrous, muscular, fatty, vascular, and skeletal. Grading of malignancy. Broders classified carcinoma into 4 grades according to degree of differentiation and appearance of cells, their nuclei, and the number of mitotic figures. The 4 grades are: grade 1 is least malignant and grade 4 was most malignant. Carcinoma in situ has cytological characteristic of malignant tumors, but with no detectable invasion into the surrounding tissue or infiltration into deeper cell layers. Routes of spread. Metastasis may entirely dominate the clinical picture, where the primary tumor remains latent and asymptomatic. Direct extension and lymphatic spread. Common in epithelial neoplasm of all types except for basal cell carcinoma. Vascular spread, either through the thoracic duct or by the invasion of blood vessels. Capillaries are almost invaded, veins invaded frequently, but arteries are rarely invaded. More common in sarcomas. Spread to serous cavities. These are like peritoneal seedings. Gastrointestinal carcinoma is most common. Clinical features. The onset of neoplastic state is difficult to date, is asymptomatic. Severe danger signals for cancer are change in bowel or bladder habits, a sore that does not heal, unusual bleeding or discharge, thickening or lump in the breast or elsewhere, indigestion or difficulty in swallowing, obvious change in the wart or mole, nagging cough or hoarseness. Indirect or systemic manifestation. Secondary to metastatic was cachexia. Secondary to non-metastatic was ectopic production of known hormones, secretion of unidentified hormone-like substances, toxic substances secreted from the tumor, autoimmune like host is sensitized to an antigen from the tumor. Signs of expansile growth or obstruction and destruction. Signs of infiltrative growth like tumor infiltrates the nerve, causes pain, numbness, and paralysis. Signs of tumor necrosis like bleeding and infection, or tumor may become necrotic, ulcerate, and bleed. Fatigue and weakness in right colon cancer due to anemia. Inflammation caused by cecal carcinoma can mimic the clinical symptoms of acute AP or cholecystitis. Unknown primary tumor presents as metastasis. Diagnosis of cancer. Clinical history. The warning signs for cancer are like weight loss, loss of appetite, bleeding or discharge from any body orifice or nipple, sore that is slow to heal, persistent cough or wheeze, change in voice, difficulty of swallowing, change in bowel habit, growing lump in the skin, breast, abdomen, or muscle. In physical examination, we can see palpable masses which are either may be movable or non-movable, and lymph node enlargement will be present. In laboratory examination, blood examination and radiological procedures like X-ray, esophagogram, barium enema, mammography, thyroid scan, CT scan, and MRI. And also endoscopies like bronchoscopy, esophagoscopy, gastroscopy, proctosigmoidoscopy, colonoscopy, and cystoscopy. And in laboratory examinations, we also can proceed to biopsy to document presence of malignancy. Types are needle biopsy, incisional biopsy, and excisional biopsy. Rapid frozen biopsy or exfoliative cytology called pap smear. Clinic staging of cancer. Clinical staging of cancer. This was staged by TNM classification. Stage 1, cancer confined to its primary site. Stage 2, more locally advanced disease. Stage 3, metastasis to regional lymph node. Stage 4, metastasis to distant sites. Post-surgical resection staging. Pathological staging. The extent of disease using all data available at the time of surgery and on examination of completely resected specimen. Retreatment staging, like restaging is necessary for additional or secondary definitive treatment after an interval following first treatment. Autopsy staging, like used only when the cancer is first diagnosed at autopsy. Interdisciplinary approach, surgical resection 55%, radiation therapy 34%, chemotherapy 22%. Surgery and radiation represents treatment of cancer that remains localized to its primary site or regional lymph node. Chemotherapy and immunotherapy, when effective, against tumor cells already metastatic to different organ sites. Goals of therapy: when localized with evidence of spread, eradicate the cancer and cure the patient. Spread beyond the local site, control patient symptoms and to maintain maximum activity for the longest possible period of time. Criteria of incurability: distant metastasis, evidence of extensive local infiltration of adjacent organs or structures. Patient's general condition and the presence of any coexisting disease must be considered in planning therapy. The psychological makeup of the patient and the patient's life situation must be considered. Surgical resection, surgical curative resection, wide local resection, low grade malignancy, basal cell carcinoma of skin. Radical local resection will be done in high grade malignancy, en bloc LN dissection for breast, esophagus, gastric, colorectal carcinoma. Surgical palliative resection will be done to relieve symptoms to prolong a useful, comfortable life, gastrojejunostomy and colostomy. Radiotherapy. Radiotherapy destroys tumor with preservation of anatomic structures. Direct toxic effect to cells due to ionization of water. Chemotherapy. In chemotherapy, antimetabolites inhibit enzymes of nucleic acid synthesis like methotrexate and 5-FU. Alkylating agents substitute alkyl group for the hydrogen atom. Alkylation of DNA molecule interferes with replication in transcription. In chemotherapy, antibiotics from soil fungi form stable complexes with DNA and inhibit synthesis of DNA and RNA like actinomycin D, doxorubicin and bleomycin. And vinca alkaloids bind to microtubular proteins necessary for cell division, causing cell death during mitosis, vincristine and vinblastine. Immunotherapy. Immunotherapy inhibits proliferation of cancer cells with affecting function of normal cells, stimulates the host to generate specific immune response to its tumor vaccine from tumor cells. Tumor-specific anti-serum like murine monoclonal antibodies, immunotoxins. Non-specific immunotherapy will be by PCG vaccine. Prognosis. There are determinants in prognosis like site of origin of primer, stage of disease, histological features of cancer, host immune factors, age of the patient. Thank you.